It's been a big week for medical news, so who else could we turn to help walk us through it all but the one and only Dr. Robert Parisian, orthopedic sports surgeon, medicine surgeon at Mount Sinai. Great to have you back, doctor.
Great to be here.
There's certainly a lot of developments right now. Let's start with today's breaking news that the World Health Organization has declared monkeypox a global health emergency. This is after 16,000 cases have been reported in 75 countries, more than 2,400 of which are in the United States right now. How worried should we be about this?
So you're exactly right. So monkeypox is something that we discovered or identified in humans for the first time in 1970, and so it has been out there. However, we are seeing, as you said, an increase in the amount of cases, nearly 17,000 globally. Here in the United States, we have about 3,000, and then about 900 in New York City. So monkeypox, and we're all used to COVID, for example, and the spread of COVID. Well, monkeypox is a little bit different. So monkeypox will show up as blisters and pimples throughout all over the body because it's a pox virus. If you think of chickenpox, for example, and so you can sort of readily identify that in other individuals, and it creates a lot of skin-to-skin contact to really pass that virus along. That's why I think you have it, a couple instances where you have these two kids in the same household. They may have been sharing bedding that was the same, and that's why they both had the spread of it.
How easily transmissible is it?
So again, as I said, it's not quite aerosolized, although there are droplets in the air if you are that you can inhale. But mostly it's really through skin-to-skin contact when those blisters and pimples and sores are exposed. And so really you want to wait. If you have monkeypox, then you want to go out and only gather when those blisters are resolved, because then you're not shedding the virus at that time.
Turning now to the president's COVID-19 diagnosis this week, he's reportedly been improving. He's been prescribed Paxlovid, which you and I have both talked about. I understand that he's on day 2 of this, so maybe where would his symptoms be at this point with the nature of the drug and how it's sort of worked with other patients? Would a lot of those symptoms be waning or improving at this point?
So that's a great question. So the president, as we know, is 79 years old. So he is in that category of patients that have a risk of severe illness once they get COVID. And so then he clearly qualifies to be on Paxlovid. Now he has twice been vaccinated. He's twice boosted. And now he's on Paxlovid, which we know has roughly a 90% reduction of severe symptoms. And so the president, I mean, it's wonderful to see him that he has minimal symptoms at this time with maybe just a runny nose and some fatigue. And I presume he's going to continue on that course. Now the Paxlovid course is a 5-day course, and we talk about rebound symptoms after Paxlovid, so that's a possibility in anyone that has Paxlovid after their 5-day course, so that'll be something to look out for, but I really think he's going to have a minimal mild course.
BA.5, I believe he has the variant BA.5, which is the most contagious, but it's not more severe. What would doctors be monitoring over the next few days just routinely when it comes to the president?
So they're going to monitor the same symptoms that they would monitor in anyone else with regards to, as I said, his headaches, his fatigue, and what his symptoms are, runny nose, things like that, regular symptoms of COVID. As we discussed before, BA.4, BA.5, all the subvariants that are coming out of Omicron, they are highly transmissible. So again, easy to spread from person to person, but they don't appear to be as lethal or as virulent as the prior strains. Another aspect of that is more people are vaccinated, more people are boosted. Population immunity in the country is higher. Over 100 million people are actually at their level of having a first booster, so it's over a third of the country. And so that really plays into it as well.
This is, I mean, when you talk about taking a second booster shot, I've had both vaccinations. I've had the booster, but now it's at the juncture where, do you get another one, especially when you're seeing an uptick in cases right now? Who is getting the second booster right now? Who needs to get it? If you've already had it, break that down for us.
Again, another great question, and that's at the crux of a lot of these discussions about COVID and what do we do moving forward. I think really important it is that high-risk population, so the elderly patients, those who have comorbidities such as diabetes, heart disease, obesity, and those place you at increased risk of, again, severe disease, potentially hospitalization or death. But, as the cases tick up, we still are, compared to January, February, we had about 3,000 deaths per day. day, and now we're down to about 300, 355. Prior, we had about 21,000 hospitalizations per day. Now we're down to about 6,000. And you're right, as we watch those numbers, climb a bit, we need to keep an eye on that. But the hospitalizations and the death rates are the two important numbers we need to keep an eye on.
I know you are not the White House doctor and you're not treating President Biden, so I'm not going to have you speculate on his condition at all. But I do want to ask, while the White House continues to project that the president is working and he's busy and he's business as usual, I mean, they certainly want to project a message of strength here that the president is continuing to do his job and that he's okay. But when it comes to, again, his age, pre-existing conditions, shouldn't the message be rest?
Well, at this point in time, anytime that somebody has an illness, or you have these symptoms, then of course, you want to make sure that person is hydrated. So they're making sure that he's fully hydrated. You heard Dr. Ashish Jha make comments about, him being able to eat and complete his meals that he's having. But, that just speaks to the sign that he's feeling well. When we're not feeling as well, then we might not eat as much. We may run the risk of being dehydrated. And so I think these are all, wonderful and reassuring things. And some people, if they have mild symptoms, well, sure, I think that they can take on and do a work day. But I'm sure he's being very closely monitored by Dr. O'Connor and Dr. Jha and the rest.
Talk to us a little bit about the summer spike that we're seeing with BA5 and a little bit about this variant. And we've talked about the fact that it's more contagious, but why do you think we're seeing such an uptick right now?
Well, again, I think it's because of that, because it is more contagious, it's highly transmissible. Also, as we've said before, and I want to be very clear, when you have the vaccine and or the boosters after, you still are going, have a potential of getting infected with COVID. So the vaccines and the boosters were never engineered to prevent infection with COVID. It's just to decrease the severity of symptoms when you have it. And the society is opening up. We have, ball games that are happening. We have the Belmont that's happening. We have different tennis events that are happening throughout the country. NASCAR events, and so people are gathering, people are getting out there, things are opening up, so the case volumes will tick up. We just need to keep an eye on the hospitalizations and the death rates.
All right, Dr. Robert Prejean, great to have you back. Appreciate your analysis as always.
Thank you.